I'm glad you all could be here today. The purpose of this demonstration is to make you more aware of diabetes and the care that needs to be provided and prevention and things you can do to make your blood sugar better and decrease your health risk for problems later. The first thing we're going to do is administer a 10-question pre-test just to determine what kind of knowledge you guys have over the topics we're going to cover over the next few days, and then we'll retake that at the end, okay? The first of today, you're all going to receive your own glucose monitoring device. You probably all have your own already, but these will be for you to take home today. It's got strips and an actual, like a control solution. I'm going to teach you how to do that. These need to be calibrated every 24 hours. I usually teach my patients to do them first thing in the morning before you check your blood sugar, about whatever time it is. Just try to do it about the same time every day. And you do it the same way you would if you were checking your blood sugar. So you guys can all take out your machines and do this with me if you'd like. Your strip's got kind of an open spot on one end. That's the end that's going to insert into the machine. And then you take your control solution and you go ahead and drop that in there as if it was like a drop of your blood. And it'll beep when you hear that. And then you just wait for the result. Mine reads 126. Now on the bottle, it's going to have there a normal and a high. Of course, these machines don't come with a high, so just as long as you do the normal, that's okay. Should be anywhere from 110 to 167. I got 126. So if you get a number in between those two, that determines that it's reading correctly, okay? Now that we all know how to use the machine, this is the machine I'm going to ask you to use to check your blood sugars with throughout the remainder of this project, okay? At this time, we would normally, we'd go ahead and take your vital signs and heights and weights with our scale. And you're also going to receive a calendar of events that's going to tell you the dates and the times of the remaining days that we have to do, okay? Now, on day 2 of the project, we're discussing the different types of diabetes. Diabetes type 1 is most of the time insulin dependent. It's diagnosed at an early age. It's just an autoimmune where your body kind of attacks itself. You don't really produce any insulin. Some of you may be type 2, some of you may be type 1. Type 2 is actually a, you can prevent it, okay? Or try to prevent it. And also on from your weights, I'll do a BMI calculation on you guys, and at the end of the month we're going to go ahead and see if it's lowered any, okay? Because if it's lowered, that helps. Now, depending on which type of diabetes you have, determines how often you should probably check your blood sugar. You can check as often as you'd like. But I usually teach my patients, we have this diabetes chart that you're all going to get a log of to send home with you. And it's just got, it says in November, the 1st through the 30th. And of course, today's the 1st, so we're going to start that. And up here, I've left these times blank for you up here. Depending on what time you're going to check your blood sugar, you can fill those in. You can check it that many times a day, at least 6 slots. You don't have to check it 6 times. But for those of you who take insulin, I would ask for you to at least check it 4 times a day. First thing in the morning, before breakfast, that's before breakfast, lunch, supper, and bedtime. Those of you that don't take insulin, try to check it twice a day. First thing in the morning and then before supper. But what I am going to ask you to do is check a fasting blood glucose. That is, don't eat or drink anything after midnight, and then check it first thing in the morning, and that's considered a fasting glucose. that should be your first blood sugar on the first column. It'll also be your morning blood sugar. If you don't like to stick your finger that many times, you can do that, okay? But it does suggest, the Mayo Clinic did some research. The doctor did recommend that you would check your sugar 4 to 8 times a day if you have insulin, or 2 or more times a day if you have type 2 diabetes, which is an insulin. But you need to record your glucose every day. In a normal blood sugar, anywhere from 70 to 120. People with diabetes sometimes run a little higher, but if your blood sugar can stay as normal as possible, the life expectancy and the risk are just as that as someone without diabetes. So it's best if we can keep them normal, okay? Depends on if you're sick, if you're, your blood sugar is going to run higher if you're sick. Some of you may already know that. So just because you're not eating, you need to continue to take your blood sugar. And if it's high, you need to go ahead and continue to take your medicine, okay? Now, on day 3 of the project, we're going to learn how to incorporate exercise into your daily activities. Suggestions I could give you, since this is a small town, you can walk or commute to local places instead of places that you would normally drive to. The park, the church, the dollar store, whichever. You can actually walk to those places, and that actually will give you some exercise. You can, if there's any place that has stairs, you can take stairs instead of the elevator or the ramps that they give you. Every little bit helps. Gardening or cleaning house, for that matter. According to an article I read, it states the adoption and the maintenance of physical activity are critical foci for blood glucose management and overall health in individuals with diabetes and prediabetes. So that's proof that it's very important for you to work and maintain physical activity to help your blood glucose. You also need to take care of your feet. I don't know if anybody of you have had trouble with your feet, but foot care is very important. Diabetics get neuropathy, and that is where they have nerve damage from high blood sugars, and they tend not to feel their extremities. Most of the time it's in their feet. A lot of times it can be in their hands, but we use our hands every day, so we can see those. But our feet, we don't look at the bottoms of our feet every day. I'm bad about that too. In between the toes especially, you need to, after you shower, you need to always make sure you dry in between each one of your toes. Wear clean socks, and never, ever, ever go barefoot, because if you can't feel, you're going to step on something and not realize that you have, and there's going to be a problem, and it's very hard for diabetics to heal. It's important for you guys to go ahead and get regular eye exams. Diabetes can cause macular degeneration if you don't take care of your sugar. It can actually do damage to your eyes, your kidneys. And A1C measurements. An A1C measurement is a blood test. We were going to have those done, but we decided against that. It's a blood test, and it actually will give you a number, and we like it less than 6. What that is, it gives us a range of what your mean blood glucose is, and that is an average over the past 3 months what your blood sugar has ran. So you need to talk to your family doctor about that, your healthcare provider about that. Usually every 6 months is what we suggest that you have it drawn for. That way you can keep track of what it's doing, because it's only good for 3 months. So we suggest every 6 months to get them drawn. And weight reduction. It's very important to lose weight. If you're overweight, if you're not overweight, it's kind of hard to lose weight, and it's not going to change anything. But if you are overweight, losing a little bit of weight will help your blood sugar. It's proven in a diabetic, the Healthy People 2020 lifestyle change has been proven effective in prevention or delaying the onset of type 2 diabetes in high-risk individuals. Those individuals are family history, overweight, things like that. Okay, stay tuned for part 2.